Arterial pulse, blood pressure, BP, means the force exerted by the blood against the wall of the vessel. Normal BP in adult is around 120 by 80 mm of Hg. 120 is systolic pressure and 80 here is diastolic pressure. Systolic pressure is due to contraction of the heart during ventricular systole, whereas diastolic pressure is due to contraction of the smooth muscle of arterial wall. Now, what is pulse pressure? It is difference between systolic and diastolic pressure. Now, what is pulse? Pulse is a palpable impulse of pressure wave of blood flow initiated by the ventricular systole. Now, what are the 7 routinely palpated sites of arterial pulses? Here there are 1. Carotid, 2. Brachial, 3. Radial, 4. Femoral, 5. Popliteal, 6. Posterior tibial, 7. Dorsalis pedis. Arterial, 7 letters. So 7 sites are routinely palpated for arterial pulses. Pulse, site and assessment criteria. Carotid pulse is felt along the anterior border of the sternocleidomastoid muscle in neck at the level of cricoid cartilage. Assessment criteria is the carotid pulse is the most reliable pulse in physiological shock or cardiac arrest when pulses at other sites are not palpable. 2. Brachial pulse. It is palpated at site medial to the tendon of the biceps brachii in front of elbow. Assessment criteria to auscultate blood pressure. 3. Radial pulse. T. Radial pulse. Site radial side of the front of forearm at wrist lateral to the tendon of the flexor carpi radialis. Assessment criteria: most commonly felt pulse to assess the character and the rate of pulse. And fourth one, femoral pulse. It is below the inguinal ligament, midway between pubic symphysis and anterior superior iliac spine. Assessment criteria: to locate femoral vein for venipuncture, which lies just medial to it. Now, fifth one, popliteal pulse. Site is behind the knee in the popliteal fossa. Assessment criteria: to assess the status of the circulation in the lower limb. Sixth, posterior tibial pulse. Site medial side of the ankle, midway between the middle malleolus and medial malleolus and calcaneus. Assessment criteria: to assess the status of circulation in the foot. And 7. Dorsalis pedis. Site is over the dorsum of the foot, just medial to the tendon of extensor hallucis longus. Assessment criteria: to assess the status of circulation in the foot.